Hi, I'm Dr. Anita Krishnan, consultant ENT surgeon with over 30 years of experience. I practice out of Bangalore ENT Care Centre, Koramangala. Are all headaches sinusitis? No, all headaches are not sinusitis. I often have patients who come in and say, Doctor, I have sinus problem. I ask them, why do you say sinus problem? They say, I have severe headache. Now, why does sinusitis happen? Sinusitis happen as part of an infective or inflammatory pathology. The most important symptoms are headache. When you bend the head down, you have too much of pain. There will be thick discharge, or we call it mucus and pus mixed discharge from the nose. You may have signs and symptoms of cold, and sinusitis normally follows upper respiratory tract infection or a viral flu. Sinusitis does not happen randomly. Now, the headache due to migraines, the other most important thing which gets confused with sinusitis is migraine. Migraine headaches are also getting confused with sinusitis because it has overlapping symptoms. Some types of migraine called cluster headaches could present with watering from the nose and severe headache. The distinguishing feature is that normally migraine headaches randomly start, especially with an aura or a trigger of exposure to heat, severe light, or lots of sound. And people always have a history like closer to your menstrual cycle. There is normally not a history of a upper respiratory tract infection or a cold followed by headaches. Migraines commonly have associated nausea feeling, and sometimes people do vomit. Once you get a good night's sleep on the day you have the headache and you wake up, most of this time the migraine headache is gone. It does not normally last beyond 24 to 72 hours. That happens only if it is a status migraine. Sinusitis, on the other hand, the headache is more when you wake up. It becomes better towards the afternoon because your sinus starts draining out. The headache is more because the sinus gets filled with secretions and it drains out due to gravity. And by afternoon, you feel better. Whereas migraine headaches are more in the evening. It is extremely important to meet a qualified physician or an ENT person, ENT doctor, to identify if it is sinusitis or migraine. Why is this important? Because you unnecessarily end up taking antibiotics thinking it is sinusitis. It is routine for my patients whom I see would have already taken one course of antibiotics over the counter from a pharmacy before coming to me for a proper diagnosis. If you keep taking antibiotics repeatedly, it kills the good bacteria in your stomach. It affects your immunity overall. So please do not self-diagnose. Please meet a qualified doctor to identify if your chronic headaches are sinusitis or migraine. Thank you for watching.